All right, everyone, it's Nikki back with Hilary. So last week we did the 6th hour, which was the only one that you're face down, and we do your sacrum, low back, back of legs. And how have you been feeling this week or sort of collectively through the 6 weeks?
Hey, everybody. I am feeling overall just like good and better. That keeps, like we were saying earlier when we were chatting offline, that I've been feeling and noticing a more cumulative effect versus the other previous sessions felt very direct to that session, and then like that whole week I would notice these things, and I didn't notice anything in particular, although in talking about it I did realize that I did notice particular things. But I do feel this general sense of integration, that I feel more aligned and connected. I think I said this last week too, but like less hungry. So I feel like there's not, I don't know, I just feel like more efficient with everything, whether it's food or exercise or anything like that. It just doesn't take as much, whatever, to get the result. A couple of things that in particular I noticed. I did have like sinus drainage after last week's session, face down for a long time, and I hadn't been feeling congested, but while I was face down, I noticed that I felt congested on the table, which is kind of normal. Yeah. But then the next day, I had like a feeling of drainage and like clearing out in my head and sinuses that I didn't even know I had congestion. And then a couple times jogging felt more, the words that you use, Nikki, are like, it's like more complete sooner. So like I only had to like go for a 20-25 minute run or whatever. And like, I'm good. Like I'm done. And feel like fatigued, like the muscles feel fatigued and complete, like exercise has like completed. And then a really funny thing I noticed, do you want me to stand up?
Yeah. I'll make sure they can see it.
I was standing like making breakfast and was at my counter and could reach to the fridge and like did this very, like to get the oat milk out of the fridge, you know, I did a very like streamlined, like reaching for the fridge, and it was so natural that I didn't notice it at first because it was just like the way my whole body moved, and you were like, oh, it's like triangle pose.
Exactly.
Like how I reach for the fridge. And it was like early, like 8 a.m. where I hadn't done anything else but like get up out of bed, and my body was like very efficient, and like it was like, that's how I'm going to move, and like put this in my tea. And then it made me stop and sort of laugh, because when I reflected back on that, I was like, that was like a textbook drawing of like
a very efficient movement pattern.
Yeah,
right, exactly.
And so that leapt out at me. And that was after last week with the legs, just feeling sort of grounded in my hips and my legs. Yeah. And that whole movement was just very normal and like,
and not pre-planned, like you were like, I'm in a triangle to my milk.
Well, right, and like, you know, we talked about that before, where, you know, even in exercising or in yoga or Pilates or running or whatever, I'm like, wait, I should focus my energy on my heel to toe, and then like reaching my legs, and like focus on my quads or whatever.
Yep.
That doesn't happen anymore. Like, it doesn't need to happen. It's just this natural movement that's coming about more frequently, I've noticed.
Right. And your body knows, oh, you know what's going to help me is if I move my heel a little bit this way, and now I'm even more efficient.
Yeah.
And you don't have to like
plan it.
Right. Or listen to the cues. The cues are no longer for you because your shoulders are already down or your core is already engaged. Right.
But I've even noticed that it's almost more noticeable to me in normal stuff, like reaching for the milk or putting on my shoes or getting dressed and like feeling very like, oh, I can put my legs in my pants and there's like no other movement happening. It's just like all leg.
Yeah. Well, and wasn't it like last week you were saying that you were out to dinner and were sitting on an outdoor bench and just kind of like put your legs
crisscross.
Up and crisscross like it was like you were 5 years old. Right?
Yeah.
And didn't think twice.
No.
Right.
And then what else? I think those are broadly the things that I've really noticed. And again, I think it's this sort of, now we're heading to this cumulative effect where where I catch myself in the mirror and I'm like, oh, you look different. And nothing has really changed, but like things have changed. Yeah. And it's, I think, how I'm carrying my shoulders, how my stomach, like, while still chubby, like, whatever, it's like, I don't know, it's just like more,
like,
strong?
Participatory?
I don't know. It's not like, it's like, okay, yes, it's chubby.
Right.
But it's not like blobby.
Yeah.
It's like, it's,
if there's a presence to it or a construction. No, I totally. Right, and for those of you who haven't been on the table, all of this will make sense when you come. That where it's like there's no language to this stuff, but it just is there and more and tighter or just participatory. And it's all of this stuff that you're just like makes us sound like telemarketers. You know, you have to feel it to believe it. And it's like, but you really do sometimes.
You really do. And you know, again, having played sports or exercised or practiced yoga or XYZ, done energy work, practiced Reiki as a practitioner. So I've like dabbled in all these things and it is something that you definitely need to just experience. I also do have a feeling of consistently that like, yes, this was the thing I needed to do at 45. You know, my I've been joking that I'm halfway to 90, but I do feel this like intuitive sort of knowing that like, oh yeah, this is going to pay dividends like as the years go on. Yeah, for sure.
Yeah,
so.
I love that. I do say this is how we prevent ourselves from turning into hunched over little old people. Right.
Yeah, I want to be like that granny that's like off hiking the Himalaya at 72 or whatever. So.
And this is definitely a reason that will something that will help that. And we break out the old patterns and we bring back the proper ones, and it's just, it really will pay dividends. I actually really love that language. So awesome.
Yay.
All right, so I'm going to come in front of the camera here because I've been across the table here. So we're going to do something a little different. So the 7th hour, which is head and neck, is just really hard to see. It's very subtle. I'm just going to be within a couple inches of her neck and head here. So what we're going to do is just put Hilary on the table, and I'm going to just mimic and walk you through what would happen on the table. And then we're going to go ahead and turn the camera off, and then I'm going to do her session. Just because you will not be able to see absolutely nothing.
Like, what is she doing?
Yeah, right, exactly. It's going to look like I'm just kind of sitting there in her head. So we're going to turn this one off and go back to and mock up the 7th hour. And thanks for listening. Yay! All right, folks, here we are with Hilary, and like I said, I'm just going to mock up the 7th hour for you, because if we did the hyperlapse thing, it just won't look like I'm doing much of anything. So on the 7th hour, we're going to start with this space, the clavicle, the clavicular sternal joint, it's called. And what happens is the clavicle gets really stuck to the rib cage. And so if you remember, or if you've seen my functional anatomy video, the shoulder girdle is made up of the clavicle and the shoulder blade. The Latin word for shoulder is actually yoke. It just gets placed on the rib cage like football pads. And so it follows where the rib cage goes anyway. If I collapse my rib cage, my shoulder blades want to come up my back. But if the clavicle needs to also be free to be able to just move more efficiently and keep the arm moving more efficiently inside that ball and socket joint. And it just gets glued to the rib cage. So we're going to pull that clavicle out, free that from the rib cage, and you are going to notice, Hilary, just a ton more breath going higher up into your lungs, because our lungs go all the way up here. And if we don't have access to breath up here because everything's glommed together. And then we're going to go into the neck, and we're going to go and just lengthen the neck. And so we go into the front part of the neck here, and that can be a little odd, to say the least, but you know, obviously you have control. Yeah, exactly. You won't be the first one that's thrown an elbow. You have control of the session. If anything feels scary or odd or not good, you know, it stops immediately as per usual. So we go in and clean up the front side of the neck. You'll feel like you have a throat for the first time in your whole life. It's super weird. And then we clean up the sides and the back and just really make the neck longer and separate the neck from the arm, which sounds crazy until it happens and you're like, oh my God, my arm was stuck in my neck. And then we're gonna come up and So I'll be in this position for these two things where I'm doing her clavicles, and then in her neck it'll look like this. And then I come up and do this super bonkers thing. I'm going to turn your head to the right here. And I come in and I actually latch onto the skull and I make the head bigger. And that's where, don't even ask me how, I don't know, it just happens. It's frackin' bonkers. And so we separate the cranium from the neck and get those things moving properly. Then I come up here and I separate the cranium from the neck and the back. We do what's called vaulting, where we make the skull bigger from here, so it would look like this. Super weird. And then I would take her mask off, and we're safe, windows open, diffuser going, everything. This is only going to be for a few minutes, and I have my mask on the whole time, of course. And we work on the face and what's called the zygomatic arch right here, and we actually make your sinuses bigger. Sinuses are just cavities between the bones, and as the bones get collapsed in, the sinuses, of course, get collapsed in. And so by pulling that facial bones out, and making more space between them, you actually will have more open sinuses. And I've had a lot of people say that a lot of their chronic sinus issues have been vastly improved after this session. And then we come down into the jaw, the maxilla here, and we widen that. That's another thing that gets really squished and pulled in. And you feel like you have a jaw for the first time ever. It's absolutely just crazy. So we'll come here and we go like this and we do some jaw stuff. And then we come and I will come this way, and from this direction I make the forehead larger. And then there'll be a couple of things that we do inside the mouth. The upper jaw gets stuck to the lower jaw, so we pull that apart and then do some roof of the mouth thing, which just sounds nuts, but it's really cool. And then we're done, and you walk out feeling like your head is a balloon, and we separate your head, we get you moving individually, and it's super cool, but it's really weird, and it's really hard to see, so hence the explanation.
I'll tell you all about it next week.
Awesome. Thanks for listening, everyone.